we're back. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. Thank you so much for joining us. And tonight we're going to be kicking off the inaugural Health Value Awards. And one of the organizations that was really key in putting that ceremony and really all of the panelists together for the awards is the Health Rosetta Institute. I'm here now with Dave Chase, who is CEO and co-founder of the Institute. Dave, great to see you.
Great to be here. Thanks so much.
Now, how was that experience of putting this awards ceremony program together, and why did you think it was an important project to embark on?
Yeah, well, actually earlier in my career, I had started Microsoft's healthcare business back when it had no credibility and it was kind of an outlier. This was back about 20 years ago. And we had put together an award that had really, it helped overcome this perception that people weren't actually doing what we knew they were doing. And I knew that there was great high value things going on in healthcare. And it was about a year ago at the event. I brought this idea up to VDAR and we really liked this idea. And quite frankly, World Healthcare Congress did the heavy lifting, so it made it pretty easy. So we're certainly happy to share the word on it, but really the organization did a great job of getting people, and kind of, in a sense, it kind of flushes people out of the weeds. You know there's great stuff going on out there, but not everybody knows about it, so it's really been great for that.
I mean, do awards matter? Do people still look at those as validation of what they're doing and getting the word out?
Well, good awards do. I mean, there's some awards that aren't that meaningful. One of the co-sponsors is the Validation Institute, and that really, they're rigorous in terms of validating what people claim. You know, there's some people kind of make up claims about return on investment.
Is that common?
It is, unfortunately, particularly in the kind of workplace wellness arena. That's kind of notorious. That's really why the Validation Institute was created initially. And so, yeah, unfortunately that happens. We didn't want to be one of those. We wanted this to be really meaningful. And the people who are making a big difference, they want to be put to the test. If they are missing something, they want to know about it so they can address it. And so there was no reservations by those organizations signing on to being validated. Okay.
What are you encouraged by in the time that you started the Institute to where we are today? Has much changed?
Yeah, very excited. I mean, we launched it, basically the launch of my book that's at this event back in Labor Day. And really the tip of the spear for us is this benefit certification for benefits consultants. And so we launched that, and without any marketing behind it, beyond the book and our visibility, we already have 3.3 million lives represented in the program. And we have a good problem to deal with, way more demand than we could have expected. We probably have a line of sight to about 10 million lives by the end of the year. So these are benefits consultants who want to adopt these high performance approaches, really learn from the best and implement it in their client base. And so that's really what they signed up to do. So there's really nice momentum, certainly a long ways to go, but 10 million lives is a great start, and we're really excited about that.
That's dramatic. You are writing a second book. Well, tell me first why you felt that there was a need for another book after the first one.
Yep. Great response to the first book. It speaks to CEOs and the C-suite particularly. But what you realize is a couple things. One is we want to speak to union leaders, civic leaders, to really understand the challenge, and in particular, as I really dove into some of these challenges in healthcare, you can't miss the opioid crisis. This is the largest public health crisis in 100 years in the U.S., and unfortunately it's an entirely self-inflicted wound by the healthcare system. This isn't Zika or Ebola or something like that. And what I learned as I really dug in is the opioid crisis isn't an anomaly. It's a perfectly logical response and tragic response to a catastrophically dysfunctional system. And if it wasn't so bad, we'd be talking about the benzos crisis. Benzos is drugs like Valium and Xanax. Over 10,000 people died of overdoses from benzos last year. So it's horrible. It's just the opioid crisis is even worse. And what you find, and what I think is really the word that I want to get out, is it's not an anomaly, it's a microcosm of the larger dysfunction. And so the title of the book is The Opioid Crisis Wake-Up Call.
That it is such a timely topic. What were some of the things that you thought could be done about this as healthcare, people are trying to figure out some solutions?
Yeah.
What is your take?
Well, there's two dimensions to it. There's the people who are already affected. Certainly they matter a lot. And there are evidence-based approaches for them. And I think those are becoming known. That's important. That's not our main focus. Our main focus is going upstream and stopping addiction before it even begins. As we are speaking, there are people, unfortunately, getting wisdom teeth out that are asymptomatic and leaving with 30 or 60 opioid pills. There's people getting non-evidence-based opioid prescriptions for lower back pain, or getting worse, they're getting surgery where there's no evidence and then walking out with that. And it's basically Russian roulette. 1 out of 6 of them generally will become addicted if they're on for over a week. Mm-hmm. And so we have to, I have this visual that we use where it's clinicians mopping up a floor and the water represents people who are addicted. Mm-hmm. And we certainly need more mops, better mops, more moppers. But in the background, there's a sink running over and the spigot's running full blast. That's what we have today. So if we don't turn off that spigot, we'll never get out of this problem.
What will it take to turn off the spigot?
Yeah, a number of things. But the silver lining in the fact that this is a microcosm of a larger problem is the same things you would do and you should do as a smart employer is doing things like getting proper primary care in place. Unfortunately, we've undermined primary care in this country. We have these drive-by appointments, so it's very easy to give somebody a prescription to get them in and out. We have too many surgeries, things like that just a good benefits plan, like some of the folks in the Health Value Awards, organizations like Rosen Hotels, they have much lower rates of prescriptions and surgeries for these things, and that's just good for the employees. It happens to also be the best way to stop opioid addiction before it even starts.
Okay, Dave Chase, let me ask you also, we enjoy seeing you here, and can you tell us what you get out of being involved with the World Healthcare Congress?
Well, it's really a combination of you meet with like-minded people who are very driven to make change, and then there's people who are maybe they're not there yet, but are open-minded to it, and they're here and they're curious about how they're doing it, and it may be there's different motivations. Some people are motivated by a big problem; they've been personally touched by the opioid crisis. Others are like, wow. We have a working and middle class who haven't seen basically any pay increase in 20 years, and they see the societal implications of that and like, okay, we're at a breaking point. We got to do something. And so being able to talk with them, and I feel like the what we call the health Rosetta, it's like if I knew the cure for cancer and didn't share it, that would be a crime. This is the people who are implementing this. The impact is bigger than the biggest blockbuster drug in history. And so it's really exciting to share what people are already doing. Every solution that's needed to address the structural problems has already been invented, proven, and modestly scaled. We just need to massively replicate that around.
All right, Dave Chase, thank you so much for your time today.
My
Appreciate
pleasure.
it.
Thank you.
And I'm Mabel Jong. Thanks for watching. Stay tuned.